listening to the Born Primitive Podcast. Good morning, everybody. Welcome back to the Born Primitive Podcast. Tony, how's it going, man?
Morning, Bear. Going good.
What'd you hit this morning?
Today was just 45 minutes above 130 heart rate on a sled with 3 plates on it. So, yeah, just some backward drag with some forward stuff. So, I've been having – actually, we could get into it because I'm sure our guests will have some input on it. But I've always had some kind of naggy stuff in my low back. So, when it gets a little too naggy, I have a protocol I kind of go through for a couple weeks just to stay moving but let it kind of get back to baseline.
Nice.
Yep.
All right. I'm doing an old school Nebraska football from the 80s. Bigger, faster, stronger. 10-8-6-4-2. Classic rock.
Nice.
Live Skinnerd album. It was good today. So, all right, I digress. So today's guest, super impressive individual, Dr. Sean Rockett, is a distinguished orthopedic surgeon, kind of known as the CrossFit doc, specializing in sports medicine. He's head orthopedic surgeon for the CrossFit Games since 2012. He is a Harvard guy, but I will not hold that against him. Earned his medical degree from Tufts, where he also looks like he did his residency in orthopedic surgery there as well. He's also a CrossFit L2, avid triathlete, and author of the injury prevention website, 321gomd.com, and you can check him out on Instagram at 321gomd. Doc, welcome to the podcast. Good to see you again.
Thanks for having me. Excited about it. Thanks, guys.
So, Doc, I think, I was going to just go back and say, hey, how'd you get into this? But I want to just hit you with a zinger right off the bat because I figured it might get us in the right direction. But is CrossFit as unsafe as everyone says it is?
There are studies, and actually we just had a big reel that just went viral, just about viral, where we looked at some studies from other people looking at injury rate per 1,000 hours of training. CrossFit, the highest in these studies was 3, basketball and football and soccer around 5 or 6, and running was at 12 per 1,000 hours of training. So CrossFit, according to these studies, is safer than running as far as missing training. Obviously, there are some things in CrossFit, like other things that you don't get with just running. But yeah, CrossFit, when done well, is safe. I think the big issue is obviously people pushing hard and getting competitive, and that's when we get into issues.
And where do you think that reputation, which, I agree, it sounds like a false reputation, where do you think that it was rooted in?
It was sort of, festival-like atmosphere at Aromas and the games, and people were seeing what these guys were putting up and just huge weights, and a lot of people aren't, into barbells, and people seeing people with barbells, and there were some injuries early on, and so I think that early on sort of raw, sort of competitive nature probably, attributed, that characteristic. But I think we've learned, the medical team has learned, we've all learned as we go, what's the best way to do it, and if you think about, just the whole goal, what's the whole goal? Is to be fit for as long as possible. You get hurt, you're not going to be fit for 9 months or 10 months, so keeping that mindset of, not pushing crazy, not pushing hard, and doing it just for a lifetime is sort of the sort of the idea that's come about.
Have you seen that kind of awareness evolve? I mean, you've been in this since the OG days. I mean, you've been the official doc since 2012, and of course it went before that, but that was kind of when it really started taking off. Have you seen that evolve from the beginning, and maybe more self-awareness from the athletes and the people participating, and hopefully less, well, maybe not a bad thing or got a good thing for you, but maybe a little less orthopedic business from people needing to reconstruct shoulders and things like that?
It's definitely tempered. I think the attitude's tempered. I think people have seen their friends maybe, tear something or tear biceps or something like that, and just realize, what's the purpose? Why are we doing this? I think the message out there has been on point. That we don't want anybody getting hurt. We don't want it. We've adjusted things at the games even to make sure that people are safer. Talking about rebounding box jumps, we saw some Achilles early on and made adjustments with that. No rebounding and things like that. So, like anything, you start early and you see how things turn out, and then you realize we can modify and keep people safe, and that's kind of what we're trying to do.
Doc, for people that are maybe north of 30, Tony, you're north of 30, right?
Not yet.
How old
I'll
are
be
you?
30 in October.
Jesus. All right, well, we're calling you 30 for this. I think the goal once you get north of 30, when you're no longer a competitive athlete, is just to obviously stay healthy, hopefully keep a good physique, and there's varying training methodologies, of course, people can adopt to reach those goals. But what are some general takeaways? Obviously, if someone's coming to you, it's likely because something went south. Doing this for many years, I guess, what are some tips for the listeners, for those that are, a little bit older? I think even, in any age north of 30, I think below 30, you can get away with some overtraining and you can, bounce back quicker. You can go drink 10 beers and still hit a hard workout the next morning. Those things don't apply at a certain age. I'm in that category now, Doc. So what would be some general tips for the listeners, and what are some things where people go wrong, and which ultimately lands them a seat at your office?
Yeah, you don't want to see me unless you're at the bar together. The number one for, you talk about people our age, do not compete with the 20-year-olds. They just can do this without worrying about the stuff that we have to worry about. So the 40-year-olds, the 50-year-olds who are looking at the 20-year-olds, they don't even look at the 20-year-olds. Number one, they get away with a lot more than we do. Number two, making sure there's rest. You need rest time. There's people who sort of get into the CrossFit early on and they start coming in maybe a couple times a week, and then they're showing up 7 days a week, double sessions, and they're starting to go for the games. They're into that sort of that mentality. So number one, definite need built-in rest as we get older. It's stretching, yoga, mobility, all that good stuff, but not making sure every day is not the games. You're not training for the games every day. Every day, cannot be that kind of intensity. You just need built-in muscle rest activity. Other stuff, too much, too soon, too fast. Tendonitis, number one thing I see in the office. I hate seeing it because it's not surgery. No, I'm kidding.
You're wasting my time here. Beat it.
But yeah, number one thing I see, people just overdoing it, doing too much, too soon, too fast. I would say those are sort of the top three things that if I could impart that wisdom over the past 30 years to people, that would be helpful.
And I think for people that do mainly CrossFit or kind of high intensity interval training, I've adapted my training quite a bit, because I used to be all CrossFit, and of course there was usually conventional strength and Olympic lifts at the beginning, and then you'd hit Metcons, and then since we were competing, there's usually a track workout, there was some swim workouts. It was pretty much every form of strength and conditioning, but it was a lot of volume. Now, of course, I don't need to do that anymore. So then at a point I was just doing high intensity interval training, which was CrossFit for 5 days a week. But now I've adapted it where there's a couple days it's just all strength. Like today I was, in the intro, 10, 8, 6, 4, 2, old school Nebraska, bigger, faster, stronger, as tested as time. But then, tomorrow I'll ramp it way up and hit, maybe a 30-minute EMOM and just get after it with 3 different movements or something like that. So do you think that's better? Like, I guess what I'm asking is there risk of kind of adrenal fatigue of doing the high-intensity stuff 5 days a week? Or, some people 6 or 7 days a week. I think that's probably an obvious yes. But I started doing some research because I was just constantly fatigued. And I thought maybe even though I'm only doing it 5 days a week, and some of the workouts, they're only 9 minutes, they're only 12 minutes. But it's of course when you're doing it, you're going. And I went back to some of my old football stuff of just like, all right, maybe there's some days where I shouldn't really get out of breath and just move big weight and just work the big muscle movements. And then the next day you can ramp it up, because I still want to maintain conditioning. I don't want to be that big meathead that gets out of breath going up a flight of steps. So could you speak to that a little bit, if you have kind of a recommendation? And how maybe overdoing it might affect, obviously just overall vitality outside of the gym.
I think that's great. I think I like that, not going hard 5 days. You don't have to get heart rate to the 180s 5 days a week, and cortisol, as you said, is a stress hormone. So if you're being stressed 5 days a week, you could get into some stress reactions where your cortisol levels, can start to be affected. And then, yeah, if it starts affecting your sleep and your work and your fatigue level, yeah, certainly I see a lot of overtraining. And, in the military too, the number one reason for disability, temporary disability is overuse injury, and back pain. These are two things that are probably preventable. Being smart, picking and choosing your battles, knowing when you got to push hard but also incorporating that rest and injury. I can't emphasize enough, to be in shape and to be fit is to not be hurt. Like that's like the negative of being fit is being hurt. And so if you can avoid being hurt and when you're fatigued and you're jumping from a rope and you're fatigued and your muscles aren't there to, give you all the support you need, you roll an ankle, you turn an ankle, and you're out for 6 weeks with that. So, making sure you're sort of feeling fit enough to be able to do all these other things, whether it's military or CrossFit or life or anything.
Yeah, and I think something interesting, Doc, and I'm sure you've seen this a ton, and Bear, you too, is that overuse, and as athletes, I think at times we definitely leverage, like former athletes, like leverage far into that, is that you can continue to train really hard and even see results there, but the downstream effects of overtraining are often what start to have a detrimental effect, meaning you'll still be able to show up, do your workout. Now, we'll do it long enough and that will start to deteriorate as well. But then as Doctor said, how you're showing up at work, how you feel throughout the day, a lot of times people don't even associate with their training because they're like, well, I'm still making results in the gym. My body's still progressing in the way I want. But it's well, how do you feel? How's your sleep? How are you, how are you able to show up at work and for your family? And that's where I think a lot of people start to connect the dots. And for people who have trained hard their whole life or with athletes, the light bulb kind of comes on of oh my gosh, this isn't I need to do a newer type of workout. This is I actually need to take a step back and maybe not rev my system for so many days in a week. On the other side of that, Doc, I'd love to get your opinion on kind of the when an injury sets in, kind of the approach to handling that in a way that maybe doesn't force you to just say take 3 weeks off, because you see that a lot of somebody has really good consistency, and I've even had this myself, where you're really consistent, you're feeling really good, something naggy sets in and you take too big of a step back, and then all of a sudden 4 weeks later you're kind of back to ground zero, where kind of an alternative approach is hey, yes, I may not be able to do 100% of what I would typically do, but let's find a way to scale. Let's find a way to work through this. So can you give advice there? Because I think for people too who are really that working out isn't something they crave, they'll build some momentum, but then inevitably you're going to have something happen, and then you talk to them 6 months later and they haven't been in the gym once. So can you give some practical advice for individuals that struggle with kind of, I guess, falling off the wagon when something little sets in?
So I do a lot of workers' comp, people get hurt at work. And the number one thing for getting somebody back to work and getting somebody sort of back into their position, say they have a back injury or knee injury, is actually getting them back to work, on a scaled fashion, a light duty fashion. They've done studies where people, and again, it could be anything, could be, just hurt at the gym or hurt at, anywhere, military, anywhere. If somebody is disconnected and they form this bubble around themselves and they isolate and they stay at home, the chances of them going back to work are a lot less. And same thing with training. If you just leave the gym, you start to lose connectivity, you lose your friends, your community. And so the people that do the best actually are the people that still go to work or still go to the gym. And the big thing is modify. So getting blood flow, getting some kind of blood flow is good. Oxygen is good. It brings healing cells to the areas that are hurt. So laying on a couch doesn't help, so doing anything to modify, to protect the injury, but also to maintain a little bit of fitness, as long as you're not hurting the injury. So that's the key with any kind of sports medicine, is trying to get people to stay, connected, stay in the community, workers' comp, get them back to work as fast as possible. People sit at home, watch TV. Number one commercial on TV during the day. Have you been hurt at work? We are lawyers to help you, pin it to the worker, or to the employer. So people start seeing all these commercials. They start, just going back into this big bubble, and it's a vicious cycle. So yeah, absolutely modifying, doing stuff that you can try to maintain fitness. If it's an upper body thing, stationary bike's beautiful. If it's a lower body thing, ski erg is beautiful. You're just seated doing upper body stuff, or dumbbells, or whatever it takes. But anything and endorphins. People downplay endorphins. The benefit of endorphins from a workout are tremendous, mentally, physically, everything.
I had a really interesting, so John Donaher was like a world-class jiu-jitsu coach, literally known as like the best jiu-jitsu coach in the world, has a private gym where you have to get invited to. And I had the privilege of sitting down and having a conversation with him. And something he said I found in the same vein to be really interesting is when he has a high-level jiu-jitsu guy go through an injury, which is very common with them, he has them just sit on the side and watch the other athletes and mentally act as if they're still rolling with the guys. And he's like, so we have a 2-hour roll. And what he found is that, and it's exactly what you just said, doctor, like those guys are so community driven. Like that's their whole livelihood is rolling. So like if they disconnect, and even when they were just doing rehab, still staying physically fit, he's like, they would come back and they lost their edge. Whereas he found, and this was just years of kind of trial and error, when they sit there and mentally go through the reps, he's like, they can hit the ground running in a way that you wouldn't even believe. Some of them even progress while injured because mentally they're staying so engaged with the sport. So I think, and that's of course an extreme example, but it's a really good case study to show like, yeah, hey, when you're out of it, find ways to stay connected, find ways to stay mentally in it, because as you know, like that's such a large part of the game. And if you convince yourself, and that's what those commercials are trying to do, as soon as you build a story that you are hurt, like you will continue to confirm that both through your thought patterns and then your actions.
Yeah, that's great advice. It's this mental thing, right? Keep the routine.
Yep.
If you go to the gym 5 days a week and all of a sudden that goes to 0, like just show up, get on the bike, do whatever, even if it's not the output. And Doc, I had a specific question on kind of because when I played football in college, there were a lot of shoulder injuries, obviously. So guys would be in a sling after a surgery and they'd be doing single arm dumbbell bench. And I think the idea was that the body seeks equilibrium, so you can still continue to build strength on that other side. And then when you're able to start, get out of the sling and start rehabbing that to the point where you can start doing weights again, that left side will recover faster because the right side, either maintain its strength or even got a little stronger. Is that a real thing, or was that our coach just trying to keep us busy and not feel sorry for ourselves? Because that could be applicable if it's a single side injury, even if it's a leg, still doing single leg squats on the other side, obviously modified, make sure you're not, compromising the other side. But that could be a good kind of takeaway too. Is that recommended, Doc?
Yeah, I have a lot of people who get worried about becoming over, hypertrophied on one side versus the other. And I said, don't worry about your body's, once your other side's normal, you're going to be fine. But I think, blood flow and getting all those chemicals, those growth hormones that are released when you exercise, and the endorphins, I think that's helpful. And then, there are, even if you're doing a dumbbell bench press on one side, there are other muscles that are being used subtly, even if you're in a sling on the other side. You're not hurting the other side, but there's definitely other stabilizers around the pec and the scaps and all the muscles in the back. You're still using those other muscles. So yeah, I'm all for that.
And then Doc, kind of on the flip side of that, where is the line for you that you would recommend? So let's use like a hip or an AC joint or something, like where it's been, let's say it's been 2 or 3 weeks and it's really, really naggy, and like you can almost impossible to even do like modified movements. Where is the line for you where you do make the recommendation like, hey, this is something worth seeking out, whether it's just a general doctor or an orthopedic, to kind of get a look at it and see what could potentially happen?
A lot of it is historical. Was there a hit, or was there a rip, a tear, a pop, a sudden injury? Was there something that happened? You dropped something, you fell, some trauma. That's more, see somebody sooner. But if it's like I was working out and my shoulder's sore and achy and nothing happened, no injury happened, I'll give that person, at least 3-4 weeks of taking it easy, modifying, and yeah, backing off on whatever you're doing on that side. And then if that doesn't improve, and again, most of that is tendonitis. You were doing too much too soon, or you're just doing the same thing. A lot of people come in and they're walkers, and they have this horrible hip tendonitis from just walking. That's all they're doing. They're not strengthening, they're not stretching, they're not doing, weightlifting, they're not doing upper body. They just walk, and they get horrible hip tendonitis. So, definitely mixing things up, doing other body parts is really important to avoid that. But yeah, if somebody has no trauma, just overuse, at least 2 to 4 weeks of modifying before I'll should even see you.
Doc, Tony and I kind of like to dork out about, I guess some might call it biohacking or emerging kind of medical technologies. But I know from our phone conversation, you do PRP now as well as, of course, orthopedic surgery. Could you give the listeners just a quick overview of what that is? And as I understand it, that sometimes can be a replacement to surgery, which, of course, is a great thing. When do you typically use a method like PRP versus going under the knife? And how has that evolved over the last couple of years?
So when it came out, I was very skeptical, like, any good orthopedist or scientist, there's a lot of new stuff out there. There's a lot of new products, and I was skeptical. It took many years, and we finally got some good orthopedic studies on it that show that it's can improve things longer and better than cortisone. So than a cortisone injection. So PRP is where you draw blood, you spin it down, you get the plasma, and the plasma has growth factors in it, which are anti-inflammatory in nature. So the other part is PRP is not regrowing anything. It's not regrowing tissue. It is an anti-inflammatory that helps with pain, say from a tendonitis or from an arthritis. We haven't seen it develop into the fact that it's regrowing cartilage or eliminating arthritis or reversing arthritis. It is reversing the chemicals that cause pain. And there are these things called platelet-derived growth factor, insulin-like growth factor, a bunch of different growth factors that are concentrated in that plasma that act by dampening or turning down the inflammatory cascade in your body.
Okay, so if someone, like, I'd say, has a partial tear, can that be a solution to that? I know obviously a lot of people can get by with partial tears. I mean, I have one in my hip right now, and I took your advice, chilled out for a few weeks, which was difficult, and I'm pretty much good now. Or for the
How'd it go? Did it go okay?
Yeah, things are good. I mean, when I talked to you, it was keeping me up at night because I felt like I had a toothache in my hip. And then, you had said, hey, chill out for a few weeks and see what happens. And that was hard to do, but I did it, and now I'm good. So, I think clearly in those situations, like a partial tear, you can probably carry on in most ways. But is that something maybe you try PRP first? Because if it's not actually regrowing tissue, of course, that tear will still be there after the fact. So I guess how do you distinguish, in that instance?
So when you have a tear, the joint, like a meniscus tear, say, the joint is irritated, inflamed, swollen, painful. And some meniscal tears just quiet down on their own. They literally, it's like a hangnail. If you stop pulling on a hangnail and you stop irritating it, then it stops, inflaming the joint. But yeah, so for, say, a meniscal tear or arthritis in the knee, you do a PRP, the chemicals that cause the inflammation, you can take it. It doesn't help heal that tissue or repair that tissue, but it can help with the chemicals that cause pain. Muscle tears, they've done some PRP studies with muscle tears and like a hamstring tear, and there's some mixed results on it. Whether, when you rip something, your body's really good. Like, when you rip something, you've got those repair cells that are flooding in there. You got blood all coming in, trying to get the fibroblast, get the macrophages, get all these cells to grow back together. So adding some platelets, to that, is that going to help much? Probably not, I would say, in my opinion. But if you have a tendonitis that's just not improving because of pain, or an arthritis not improving because of pain, I think that can help.
shifting gears a little bit, Doc, where do you land? And this is something we've had other doctors on, and we've kind of talked pretty thoroughly through. And there seems to be a spectrum of I don't integrate it at all, or some that like, no, that's a integral part of how I treat patients. Where do you land on kind of diet in this equation? Is that something you ever address, especially in like something maybe like a chronic joint issue where it wasn't an acute thing? It's not like they blew out their shoulder or something and they're having nagging injuries. Is that something like, do you ask the question ever like, hey, what are you eating? Because personally, and I don't want to overlay just mine as a case study on it, but like as somebody who as a baseball player struggled with just L4, L5, like low back pain, how I eat, and even if like Bear said, if I decide to have 4 or 5 beers, I can tell the next couple of days in my back that like something it's raising the inflammation in my body, and I can see it. So is that something, where do you kind of fall on that spectrum of kind of diet intervention, or just kind of that as being one pillar to address more chronic pain?
Yeah, no, definitely. Arthritis. I mean, I've felt the same thing. I have arthritis in my knees, and if I'm not eating well and having a few beers, I'll get some swelling and some soreness in my knees. Yeah, it's not the first thing I ask people, and I'll try to figure out a solution, and then, but yeah, certainly with arthritis and somebody's coming in and they're a little overweight, and I'll ask them about their diet, and I believe, personally, that with sugar and added sugar, increasing inflammation and inflammatory tissues, I'll talk to them about a carbohydrate, lower carbohydrate, lower added sugar diet, and increasing protein, and seeing if, and I'll tell them, that you can always do surgery. You can't take surgery back, but if you can do things to avoid the surgery, that'd be great. And I have a ton of people who literally can say that, like, I've changed my diet and I feel better. And that happens all the time.
Is that something you think from like a training and schooling, do you see that shifting in a direction where you think like traditional medical school will integrate that more? Or because that I mean, 10 years ago, I think when I found out that like there isn't, and you can speak directly on it, that there isn't a ton of nutritional training, that was really shocking to me. And now what's encouraging though is certain doctors we've had on, it's like they kind of just either self-educate through trial and error on their own self, or just realize, hey, this needs to at least be part of the conversation. So are you kind of optimistic in the direction that'll go? Or?
I think almost the internet like has spread, a lot of these reels and videos and it started with me and CrossFit. And I started hearing, with CrossFit about like, the people doing low sugar and low carbs. And I was like, no one had ever said anything like that to me. Growing up, and certainly when we grew up, we weren't even thinking about that with my family. But as I've gotten, more experienced and seeing what that diet plus that exercise does to people, and how it can really just, have so many friends who have transformed their bodies because of diet and exercise, and just literally been doing CrossFit for 17 years, and seeing the proof is literally right before my eyes, as opposed to in med school in the books. Like, we weren't taught that, but I think the internet and just the younger generation hearing more about it, and hearing, what a low carbohydrate, no added sugar diet can do, it's sort of just evolving. I am hopeful.
Doc, what's your take on or stance on stem cell?
Stem cells have been studied, and they haven't had as good success as far as pain relief with people, and in the orthopedic literature, at least, that I've seen.
Because obviously, like, I don't think it's technically maybe not legal in the United States. You got to go out of the country. Do you think that technology will evolve to be kind of hand in hand with PRP as an because as I understand it, the hope is that will actually then regrow like tissue and ligaments. So if it's a partial tear, you could, in theory, inject.
It's tough to you look at a knee joint, you look inside a knee joint, and you see the arthritis, and just to think that an injection can take away arthritis, or to regrow, like you just put an injection in there somewhere and it's going to redo stuff, is because it's a mobile joint, it's moving, there's a fluid environment, And just putting an injection in and hoping that it's going to transform cartilage growth, is a tough leap, just because, the mechanics of the joint, it's moving around, it's constantly grinding up against the other surface. So I think the future is gene therapy to prevent the breakdown of cartilage in the future. I mean, that's the true, like, if you had a gene that your family has a history of arthritis, and we're going to identify the gene that the protein, the cushion on the end of the joint. Here's the the cushion on the end of the joint is that's the articular cartilage, and we know that breaks in people with early arthritis. And the key is to avoid that breakdown in the first place. How do we avoid that breakdown? And they've talked about gene therapy to try to identify the people who have it and prevent the breakdown in the first place. I always tell my residents, I go, when do you think people are going to laugh at us for putting metal inside someone's body? Like, how many years in the future do you think that's, they're going to look back at us and go, really? Like, they were doing that? Just because it's a big surgery, but I think it could be 20, 30, 40 years maybe.
And is that, and I'm going to be out over my skis a little bit here, so hopefully you can probably describe it better than I can, but kind of circling back to kind of the diet and lifestyle, is that kind of the mechanism that could potentially be happening there? When is that epigenetics, and that's where I'd be out over my skis to say that I can go down and talk about that thoroughly, but when people may have that gene expression, but through diet and other lifestyle things, that there is kind of a upregulation or downregulation in the expression of that. Is that kind of what, do you think that's kind of what happening, when the difference between somebody who may have the same exact, let's say twins, whereas one though has really healthy, both like kind of healthy mental and physical habits, while the other one doesn't, and that they may be expressing that through, or be able to downregulate that through healthy lifestyle choices?
Yeah, that's probably out beyond my knowledge too. But yeah, I mean, say someone's A1C is completely elevated, in the 7.5, 8.0 region, that extra sugar that's circulating in your system, you're saturating a lot of chemical process with glycosylation, where you're adding sugar to the process can break down, certain processes. So, that could be certainly a factor. Yeah.
Doc, how about cold tub sauna? Are you on that bandwagon yet? I am. I think you kind of are.
Oh, yeah.
What are your thoughts on that as it pertains to just recovery and vitality?
I love the sauna. We have one in my house. I go to Cape Cod. I don't go to Maine, so I hate being in cold water. I can't stand cold water. So, but yeah, no, I've seen some of those studies on it, and just the benefits that people say they get from it. But yeah, I think sauna, the data on sauna is incredible.
Yeah, I know, like
really, truly incredible.
Yeah, like the Swedes and stuff have done a ton of research on.
Well, I was talking to your brother about this. He was telling me he was overdoing it. Like like don't do more than like 3 days a week, 30 minutes, and then but otherwise it can start smoking. I had never heard that. Do you know, like, is there general protocol for like?
Well, there actually is a study where every day it actually was better, but I think the factor, and it's what we kicked off with, is like, if you're training hard and you're doing sauna and you're doing track work, like, then all of a sudden your central nervous system, and this is like bro science, but is that then I think you could be in a place where you're just overtrained, like, because it's almost like a conditioning session. Like, if you go hot enough for 30 minutes, like, your heart rate's going to be at 170, 160 if you really push it. So I think that's where that line is. But doctor, I think there are some studies that actually show that like 6 days a week was I think significantly better than 3. But I heard that a long time ago.
I think I was at the CrossFit Health Summit, and Rhoda Patrick, Patrick talked about that. And then everybody asked about the precise temperature. Is there a specific temperature? And I think it was, I want to say I forget what it was, 120, or there was a certain, it had to be above a certain temperature to get the benefits of it. But yeah, she was a great speaker to hear, and as an orthopedic surgeon, sort of, and through the CrossFit world, I'm coming into this. And so I have to keep up with all this stuff that is not, what I'm trained to do, orthopedic surgery, we're looking at fixing tendons and tears. But, so I'm like anything, like a good scientist. I'm always trying to get new information and learn new things and see what's true, what's not true, what's good, what's not good.
Well, and I appreciate because I can imagine for you, it's got to be strange, like what the internet, and you mentioned it earlier, like what the internet did to knowledge transfer, both good and bad, is just insane over the last 15 years. So for you though, I really do appreciate your openness to saying like, hey, I want to stay up with that, because I'll be candid, like as an athlete back in college, I would talk to some doctors where it was as if I was like attacking them if I tried to mention anything outside of what they had been trained to do. And it was super frustrating for me, who tries to like I was a biology major, which means absolutely nothing because I never used it, but like had a base level of knowledge and like to do self-research. So it was frustrating certain doctors. It was like, hey, I'm not trying to attack, like you're way smarter than me. I'm just trying to have a conversation. But it was like a hit on their ego if you tried to at all go outside of what they're kind of what they had been trained to do. So I really do appreciate you said like being open to kind of the different modalities.
You probably got to deal with people that are coming in, read a bunch of internet articles and are, giving you advice on how to treat the injury.
Stay off the internet. No.
Yeah, you gotta.
No, the internet has been great. I would say more helpful than not, because people come in, they're like, I've heard about this as a complication. I know this is a complication. What are your numbers? What are your percent? Like it's a well-informed person. You get into trouble when they start going, they come in with the literature this big and they want to know, so that's rare. I would say it's more helpful because a lot of people know more details. Also, the people that have actually watched some of the hip or knee replacements, when they come in, I would recommend not watching the video before you come in. Because those people are all, they're like, I can't believe you're doing that. I'm like, yeah. So you might want to wait to watch the video till after you have the surgery.
Well, you guys are basically like carpenters, but on humans, right? Like you got saws and you got drills, and I mean, it's, if you actually like, when you realize what you guys actually do, like that's pretty crazy.
It's either carpenters, invalids, or jocks. Like invalids because we were getting hurt, jocks because we were always getting hurt. Then carpenters, like people that like to fix things and put things back together.
Yeah. My fiance's mom just had a hip replacement. How has that one become so, like, that one seems to have advanced at a level that even other like joint, and maybe it's just the joint itself, but the fact that somebody can have a major hip surgery and then within like a couple days they're not back to normal, but they're completely like walking normal. And you would think with such a large joint that would be like an ACL where you're like down and out hard. So what is it about that surgery? Was it a technology thing, or is it just the joint itself that actually makes it compatible for faster kind of like recovery?
Like a knee has, I think, more nerve endings around the knee, and I think with a hip, it allows for more swelling. Whereas the knee, if you have a swelling in a knee, it like blows it up like a balloon, so it becomes very painful, very tight. The hip, not as tight a capsule, and so, but the technique has gotten better. The amount of incision that we realize we don't need, so we can get a smaller incision and release fewer things has been much better. And yeah, a lot of the instruments and the devices that have helped our smaller incisions has also helped. So we're less traumatic, smaller incision. Our hemostasis, when we go in and we're coagulating, the devices that we have to coagulate blood vessels, so we're not getting a lot of bleeding too. Somebody can have a hip replacement with about 100 cc's of blood loss, which is really a small amount. And then therapy has been a big part of it. Realizing what people can do. I mean, we used to put people in the hospital for 3 weeks with a hip replacement. I joked about it in residency. We had them there for like 4 or 5 days in residency. I said, we're going to be doing these as an outpatient someday. And people were like, no, they were laughing at me. I said, no, you'll see. It's gonna get there. So a lot of reasons for that.
And this is kind of a strange question, but do you find yourself, just given the nature of, like Bear said, that you're literally working in a time sawing, cutting like the human body, but describe the state you find yourself in, and I'm sure it's different day to day and even year to year, but like when you're performing these surgeries, Is that something like, do you find yourself in a flow state as you're kind of like working through the intricacies of like what needs fixed and whatnot, or kind of walk me through how you're feeling and kind of the mental space you're in when doing these?
Yeah, I've read about flow state with sort of military athletes and surgeons, and it's I would remember I don't know, I think it was a movie Tin Cup.
Yep.
uh, where it was just sort of like you just get your vision, your field of vision just sort of narrows and everything just sort of comes together. I play, like 80s music, and so I'm not even thinking. But yeah, you're at a level where you've done something long enough, well enough that you're not even thinking, you're just doing, and you've got a team that you don't even have to ask them. They hand you the things that you need. Like, so just like anything in life, if you've done it long enough and well enough and you have a good team around you, you're literally, I always say, like if I'm out boating, and I didn't grow up boating, and my wife grew up with a boat, and that's stressful for me. Like I'm like, I'd rather be in the operating room right now, like being on a boat and dropping anchor and coming into a slip, and like that's stressful for me because I didn't grow up boating. So I've gotten better and I've gotten good at it, but like, yeah, just it's literally no stress, low stress. It's like the place where I want to be. Like it's just doing my thing. It's fun.
And did you feel like once you completed your residency, like, was that right away? Like,
No.
when did you find that groove? It's almost like the 10,000 hours thing.
Yeah, probably a couple of years. Took a couple of years. Like right now, I'm in my wheelhouse. Like people say, "What kind of surgeon do you want?" Do you want the 30-year-old, or do you want the 70-year-old, or do you want the 50-year-old? And sort of 50-year-old surgeon is kind of the place where you want to be. You've trained enough. You've seen pretty much, I don't want to say everything, but you've seen things. You've gotten out of certain situations during surgery. You've learned how to get out of things. During surgery, you always want the surgery to be exactly the same and smooth, but sometimes there are things during surgery, and being able to figure out the best way to avoid hazards is important. And that comes with experience.
Yeah, super impressive. Obviously it's a totally different craft, but just I've always thought about that, man. Like, this must be pretty intense to kind of like, it's on you. You know what I mean? Like, it's your responsibility. And are there times where you might have multiple in a day? I mean, I would think mentally that would be exhausting. You finish one, you clean up, maybe get some lunch, and then you're like, I got another one in an hour. You know what I mean? And obviously for the person getting surgery, it's a huge deal, right? For you, it probably becomes routine. But I'm sure you, from the physical fitness and mental health and just keeping yourself together, you got to be pretty dialed as a human being to just be in your line of work.
There were two things I noticed when I started CrossFitting. One was I was a better pickup soccer player because I could keep people away from the ball. I could push them off the ball or protect the ball better. Like, I got stronger. And then the other was, the day of surgery. Like, I didn't feel it. I used to feel it, like my back hurt, my neck hurt. And as I got fitter, like I didn't notice it anymore. And right now I'm doing on a regular days, like probably 6 in a day.
Oh my God.
And it depends on what the surgeries are. Some are shorter and some are smaller. We got a surgery center that has an amazing turnover time, and they clean up, incredibly well. And some surgeries, there's in some places, some hospitals there's an hour in between surgeries, but at our surgery center we're down to sort of 20 minutes. So it's efficient, it's good. You get in, you do your job. And efficiency is what you're looking for. You're looking for a team pulling together. So it's been, the surgery center has been great.
Wow, that's wild. I figured like 2 a day would be the max, but that's impressive. Holy.
Yeah.
I mean, I guess.
Yeah, again, if some surgeries take 10 to 20 minutes, so it's
okay.
not. So, yeah.
Yeah. Well, I guess that's reassuring if you're someone getting surgery to know that this is literally like so routine.
Yeah.
You know what I mean?
Yeah.
Because it can be scary, right? You don't know what's going to happen once you get under the knife. But Doc, I guess to close it out on my end, I think we've danced around this and hit this, but just to kind of close it out for people that are just looking to maintain kind of longevity and wellness, but still, maintain a good level of fitness. what would be kind of your biggest takeaways for them?
From an orthopedic surgeon point of view is, doing everything, doing multiple different things, like having sports that you enjoy, working out, strength training, flexibility, yoga, like mix it all up. Don't just walk, don't just bench press, like do everything. Your body is a beautiful, beautiful thing. And if you can maximize all the muscle groups, it's important, because all the muscle groups will help pull together, as opposed to you're just walking. You're going to get a stress fracture, tendonitis, hip, whatever. Do everything.
Love it.
And Doc, you want to plug your practice? I know, for the listeners, Doc is known as, one of the best guys in the game. And obviously not everyone can have access, because you're up in Boston, right, Doc?
In Boston, Orthopedics New England. We're out of Natick, Newton, and Hopkinton, and in Boston. 321 Go MD is my website. I got a book coming out on Rogue. We're selling a book, and it's called Where Does It Hurt? So it's going to be based on, instead of like reading a book on shoulders, there's going to be pictures about like where does it hurt, and you'll be able to read the chapters on that. So that's coming out soon. But yeah, Orthopedics New England. I do sports and joints, and anybody in the Boston area, happy to see you.
Awesome. Well, thanks so much, Doc. I know you're a busy man. You probably got some surgeries to get to based on what we just said, but appreciate the conversation. Hopefully I won't be seeing you, but if I need to see somebody, I think I'm pretty convinced I'll be coming up to Boston for a few days, and you're my guy. So thanks so much, Doc. We appreciate it.
Thanks, bud. Nice seeing you. Nice talking to you.
All right.
Doc.
We'll see you.